Welcome to Fempower Health. This is Georgie. If you've been following Fempower Health, you know I've spent years interviewing top experts, unpacking the biggest challenges and breakthroughs in women's health. But some things don't fit neatly into an interview. Sometimes I'm connecting the dots across conversations. Sometimes I'm diving into breaking news. And sometimes I'm exposing the patterns shaping the future of healthcare. So I'm bringing you something new. Fempower Health Audio Insights. This is where I break down the issues that impact you, whether you're a patient trying to make sense of your options, a policymaker shaping the system, or a doctor navigating the latest research. Because knowledge isn't just power, it's how we take control of our health, our careers, and our future. So let's get into today's post. We're going to talk about a very popular and hot topic right now, and that is menopause. It is a movement, but what can we trust? The conversation around menopause has evolved from whispered discussions to a full-fledged movement, with a market projected to reach $24.4 billion by 2030. Companies, influencers, and medical experts are all vying for attention. As we navigate this menopause renaissance, an essential question arises. How do we discern trustworthy information? So, for 2 decades, the Women's Health Initiative study, the WHI study, shaped the narrative on hormone therapy, instilling fear about its risks, particularly regarding breast cancer and cardiovascular disease. This led to a dramatic decline in hormone replacement therapy prescriptions, leaving many women to suffer in silence. Recent research suggests that the risks are overstated, especially for younger women in the early stages of menopause. Now, the pendulum seems to be swinging in the opposite direction, with some experts advocating for widespread HRT use. But have we fully reckoned with past misperceptions, or are we just jumping to new conclusions without all the data? So now we get into the rift between societies and emerging voices. A significant divide exists between traditional medical societies and newer menopause advocates. Organizations like the Menopause Society base their recommendations on extensive research. However, research in women's health notoriously lags behind. It takes an average of 17 years for medical research to become clinical practice, leaving many women in limbo. Dr. Lisa Larkin, who's a previous guest on Fempower Health, she's also been on the Menopause Society Board of Trustees since 2018, and she was interviewed in an episode on Fempower Health called The Truth About Menopause, Navigating Myths and Misinformation, Empowering Care. And she articulated this tension well. She stated that we're in a movement where experts, societies, and influencers are all working with the best information they have. But the reality is there's still so much we don't know. And this lack of clarity fuels both skepticism toward medical institutions and enthusiasm for emerging voices who promise more immediate solutions. Meanwhile, one of the most widely read menopause substacks, The Vagenda, by Dr. Jen Gunter, an OBGYN and author, offered a warning. Anyone can make a supplement and sell it. Anyone. The only real requirement for success is having a large social media following, being in healthcare, or preferably both. So now, the role of social media, the double-edged sword. So platforms like Instagram, TikTok, and Threads have become powerful tools for disseminating menopause information. Influencers and doctors alike share bite-sized insights, but at what cost? The nuance of medical guidance is often lost in social media's rapid-fire format. The recent So Hot Right Now Menopause Conference in Sydney became a flashpoint for these tensions. And while figures like Dr. Louise Newson, Dr. Mary Claire Haver, and Dr. Kelly Casperson have amassed huge followings by providing accessible menopause education, critics argue that their guidance sometimes strays from evidence-based recommendations. For example, testosterone therapy is gaining traction for perimenopausal and menopausal women, with some influencers hailing it as a game changer. However, a recent New York Times article highlights that while low doses of testosterone can increase libido, many proponents are overstating its ability to boost mood, cognition, muscle strength, and heart health. So now let's talk about the startups. They're bridging the gap, or are they profiting from it? The unmet demand for knowledgeable menopause care has given rise to numerous startups, often backed by venture capital. These companies aim to fill the void left by traditional healthcare systems, offering telehealth services and personalized treatment plans. While they address a critical need, many women struggle to find doctors who understand menopause, and those who do often face high out-of-pocket costs. There are concerns about the quality and continuity of care. Patients have reported challenges with follow-up, noting that some services prioritize efficiency over comprehensive care. Complex cases may be referred out, leading to fragmented care experiences. Additionally, while some platforms offer community support, such as private Facebook groups, free alternatives exist. The proliferation of high-cost events and services, sometimes featuring celebrity endorsements, raises questions about accessibility and the true value offered. So it's a flooded market, and who benefits? Well, with menopause gaining visibility, companies are rushing to fill the void. From supplements and bioidentical hormone therapies to vaginal lasers and personalized health programs, the landscape is overwhelming. The commercialization of menopause isn't inherently negative. Innovation and investment, in fact, can drive better care. But when marketing outpaces science, consumers are left vulnerable. A personal essay in Boston Magazine captures this dilemma. With each Instagram scroll, my menopause symptom list seemed to grow. Did I weigh too much? Was my hair thinning? Did my shoulders hurt? Soon, I wasn't just counting symptoms. I was counting the specialists I'd need to see just to feel like myself again. So where do we go from here? Women deserve better. The menopause movement is long overdue, but it must be grounded in evidence rather than by hype. So here's what we can do. First, look for consensus. Organizations like the Menopause Society offer vetted, evidence-based guidelines. And then be wary of extremes. If a provider claims that every woman needs hormone therapy or that no one should take it, proceed with caution. Then demand more from the medical system. Menopause education is still lacking in medical training. Advocating for better education will help close the gap between cutting-edge research and patient care. And then stay critical of social media medicine. While social platforms can be a great way to find community and hear about new research, they should never replace direct medical guidance. The menopause revolution is happening, but let's ensure it's driven by truth, not trends. Thank you for joining me today on Fempower Health. If you'd like to continue the conversation, please follow me on social media. I am most active on Instagram, LinkedIn, as well as TikTok. You can also subscribe to the weekly newsletter if you want to stay off social media to get the latest and greatest updates. And you can find a link to that either on my website, fempower-health.com, which is a hub to all the different health topics I've covered over the past 5 years, or you can go to the show notes where there's links to all the helpful resources that are relevant to this discussion. And if you know of someone in your life who would benefit from this information, please do pass this along, because that is how we can ensure this important information reaches those who need it most. And for anything that is discussed medically, please understand that none of what we share on Fempower Health is medical advice. It is all for information purposes only, and only a conversation between you and your doctor can give you the care that you need. Thank you very much.